Viewer discretion is advised. Sacramento, capital of California. Home to nearly 500,000 people, but lurking beneath the surface, the unexpected. There is an increase of ER visits every year. Even though Sacramento has some of the best hospitals in California, none of them beat the state-of-the-art SJVC medical facility in Rancho Cordova. The staff here, ready 24 hours a day, 7 days a week, for all patients who arrive with trauma and illnesses ranging from a life-threatening disease to a simple complaint. First patient arrives with complaints of chest pain and difficulty breathing. Putting these patients on oxygen is critical. Before any medications are prescribed, SABAs, or short-acting beta agonists, are given first for both COPD and asthma patients.
Gustavo Juan Hernandez?
Juan.
Juan?
Juan.
Oh, okay. We're just gonna. That's good.
Gustavo Juan.
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 Juan Hernandez is a 27-year-old heavy smoker. Because SJVC is a busy hospital, Gustavo has to wait a few hours before the doctor finally showed up. After we return from this short commercial break, we will hear what the doctor prescribes to relieve Gustavo from dyspnea. One of the prescriptions the doctor will give is corticosteroids, a term we will learn after we come back from this short break.
Con i documentari Sky non smetti mai di imparare. 40 canali a 15 euro al mese. Non sai cosa ti perdi. Sky.
SJVC, a well-known medical hospital in California. Waiting for the doctor to see him is a 27-year-old Gustavo Juan Hernandez.
Hi, Mr. Hernandez? Gustavo Juan Hernandez? Hi, my name is Dr. Villaflor.
Old age might be a factor,
Hi, my name is...
but the doctor will find a shocking surprise that might be a reason
So,
Gustavo has trouble breathing.
You've been having... what's going on?
Just today, I was trying to just take the trash out and just had a flare. It's got really hard to breathe.
Okay. Has this happened before?
Lots of times.
Lots of times? Okay. So are you having a fever or any kinds of other problems right now?
The doctor keeps asking about the patient's history until he heard the answer that made him suspect inflammation of the airways.
Not really, sir.
Really?
It's just this.
Okay. So, let me ask you about your smoking. Are you a smoker?
Yes, I smoke 3 packs a day.
Finding out that Gustavo is a heavy smoker, Dr. Villaflor suspects chronic bronchitis, also known as COPD. He immediately starts to assess the patient's lung sounds and orders for additional exams, including PFT, or the pulmonary function test.
Okay, Mr. Hernandez, I think you're having an acute exacerbation of COPD. And right now, I think I want you to stay in the hospital because
For how long, doctor?
it depends how your improvement is, okay? So in addition to the salmeterol and albuterol, I'm going to give you something called a corticosteroid.
What's the corticoid? Corticoid?
Corticosteroids, or in layman's terms, steroids.
Okay.
So do you have any idea about that?
No, what is that? Am I gonna get stronger?
I don't make you feel better, but you have a question about steroid, or?
Just, what is it going to help me? How's it going to help me, I guess?
Okay, so are you sure you really want to know what corticosteroids do?
See, doc, I see.
Okay, well, the corticosteroid diffuses into the cell, binds to its receptor, then kicks out HSP90,
then goes into the nucleus and binds to glucocorticoid receptor elements. So, in other words, it causes activation of anti-inflammatory reactions and suppression of pro-inflammatory reactions. And lastly is
it blocks cytokines. So that's what happens.
Okay, doc?
Well, basically, it's just an anti-inflammatory.
Dr. Villaflor explains to his patients that corticosteroids are anti-inflammatory agents which reduce symptoms. Treatment with anti-inflammatory agents such as glucocorticoids is important to reduce basal level of airway inflammation, thereby reducing airway hyperresponsiveness and predisposition to acute episodes of obstruction.
Can you send me a acute nurse, doc?
Alright, I will.
Thank you, doc.
Okay.
Gustavo was put into ICU as Dr. Villaflor prepares systemic steroids. Systemic steroids should be avoided for long-term use at all costs due to serious side effects. Gustavo will wait until a respiratory therapist brings the medication.
Hi, Mr. Gustavo. Alright, so while you're here in the hospital, we're going to give you prednisone in pill form, and we're going to give you some methylprednisolone via IV, so someone will be in here in a minute just to, stick that right in your arm for you. And then when we send you home, we've got some aerosolized drugs. We've got some beclomethasone. We're going to give you 40 micrograms of that. We're going to give you some triamcinolone, 44 micrograms of fluticasone. I think we're giving you 90 micrograms in a dry powdered inhaler of budenoside. And then we've got some combination ones here. So you're already on the Ceravent, or the salmeterol, as you called it. We're going to add some fluticasone to that, and we're going to call that Advair. We're going to send you home with that. You'll get 45 micrograms of that. And then we'll also send you home with a budenoside formoterol. It's called Symbicort, and you'll get 80 micrograms of that. Sound good?
Just whatever makes me feel better, miss.
Okay.
Gustavo has been given minimal systemic steroids to reduce airway inflammation. He will now rest overnight, hoping to see better results tomorrow. Go ahead.
Hey, good morning, Mr. Gustavo Hernandez.
Hey, doc, how you doing?
Hi. So how are you feeling?
I'm feeling a lot better,
Feeling
actually.
better?
Yeah, doc.
Okay, well, I think the steroids responded, and we already tapered the dose. So I guess you're set to go home.
Okay.
We're just gonna prescribe you some inhaled steroids, and just remember to rinse your mouth, okay? After you inhale the steroids, because you might get a fungal infection in your mouth, okay?
Oh, so just rinse my mouth. Swallow?
No, spit. Okay?
Don't swallow. Not good.
No, that's not good.
Oh, okay.
Okay.
Just spit, no swallow.
Yeah, that's right.
Okay.
Okay.
Hey, doc, I have a question though. I was looking up the side effects, like immunosuppression and psychiatric reactions and cataract formation, peptic ulcer, fluid retention, hypertension, stuff like that. Am I gonna get that too, doc?
No, I don't think so, because we did taper the dose, and we only used a very low dose of the steroids.
After strict instructions from the doctor, Gustavo has been given the order of discharge. He will now have to go through therapy classes to quit smoking.
If you do develop these side effects, just give us a call, okay?
Okay. So I should be good now. I'll be able to go back to running my marathons?
Maybe not right now. Just rest for a while, okay?
Okay.
Just remember to spit the inhaled medication.
Spit, don't
I
swallow.
mean, swish and spit
Okay.
after inhaling. Okay?
Sounds good, doc. Thank you, doc.
Okay. Hope you feel better, okay?
God bless you.
Alright, you too.
Corticosteroids have reduced inflammation to yet another patient. Used for maintenance, not only do they treat COPD, but also asthma patients. For asthma patients, inhaled corticosteroids are step 2, after SABAs and followed by LABAs. However, for COPD patients, SABAs and LABAs are given first, and then the inhaled corticosteroids. Also to note, steroids increase beta-2 adrenergic receptor transcription. That means it increases the affinity of the drug for beta-2 to make it work better.
Aerosolized corticosteroids for you to take while you're at home. We've got all the instructions in there. Just, 2 puffs of each twice a day. And after you're done taking all of them, make sure that you rinse with water and spit it out. Do not swallow it. That's how you're going to get an infection.
Spit, don't swallow.
Spit, don't swallow. You got it. All right.
Thanks to SJVC and their professional staff, Gustavo has been released from the hospital. We have talked about side effects, mode of action, and everything else we need to get credit for this pharmacology project for Mrs. Foss's class, here at San Joaquin Valley College.